Hello, this is Dr. Stanley Lang again, and welcome to this presentation, which is on Lyme disease unusual presentations. The context for this is a holistic approach that I try to present on a regular basis. That's health of body, mind, and spirit. Today we're focusing on the body. So one of the things that I've talked about frequently is Lyme disease because it is such an epidemic and so many people are undertreated. And there are so many different strange presentations that I'd like to, on occasion, put out some of the presentations that I see so that people can kind of think about what symptoms they may be having that actually might be Lyme disease and they really didn't think about it. I saw a patient today that reminded me of a patient that I saw about 6 years ago with a similar presentation. That one thing was very different. This patient complained of both of his hands had started to hurt, just the fingertips were hurting, and nothing else had changed with him. He felt tingling also, but the confusing part of this presentation was that he also had physical findings that were consistent with carpal tunnel syndrome. So I'm not going to go into why that conclusion might be drawn, but just to say that anytime somebody's got symptoms in their hands, carpal tunnel syndrome is one of the things you'd also think about. But what was strange in his case was that he had this sort of sudden onset of this tingling right on his fingertips. But because his symptoms, because his physical findings were so positive for carpal tunnel syndrome, we're pretty much obligated to make sure that that's not going on. But I have a suspicion that he actually has both going on. And the reason I'm suspicious of that is, again, because of the sudden onset of these strange symptoms in both hands at the same time. And what this reminded me of was a gentleman that I saw about 6 years ago. And the only symptom that he had was swelling in both of his hands. That was it. He had a little stiffness because of the swelling, so he couldn't move his fingers very well. But he didn't have a lot of pain, didn't have any redness, just had swelling in both hands. They both swelled up. And other than that, this very vigorous 80-some-year-old man was fine. In his case, that was back when I did Lyme blood tests more frequently. And in his case, the test was very positive. I do the test less frequently now because there are so many patients that I see that I think have Lyme disease, or at least they have a pretty good chance of Lyme disease. And if they have a negative test, I'm still going to want to offer them the possibility of a trial of treatment. So there are two ways to do that: a trial with an antibiotic and a trial with a natural strategy that we've developed that has proven to be very effective in killing the Lyme germ. So in this case, we're actually going to pursue the carpal tunnel syndrome diagnosis first, since he's not critically ill. But I'm going to be thinking about Lyme disease at the same time because, of course, people can have more than one thing going on. And the older you are, the more likely it is that you have more than one thing going on that is explaining your symptoms. So the take-home message is that when you have a sudden onset of very strange symptoms, one of the possibilities is Lyme disease. Hope this has been helpful to you. I wish you well. God bless, and have a great day.